Fundamental to Planetree, though, is the belief that if you provide patients with information, they can become active participants in their own care. So we've done that by offering patients information through our Health Resource Center, which is the largest collection of consumer health literature in the country.
Access to information is a key part of Planetree, and they believe that it's important to nourish the mind and spirit as well as the body. So we try to keep patients well informed, and we do that with the open medical record. We encourage patients to look at the record, and if possible we try to sit down with them and do so. We encourage patients to actually make entries into their patient chart.
As part of reviewing your chart, when we talked about your healthcare directives, we indicated that you would have full support, namely that we would do everything available should you get sicker than you are now.
One of the things that we look at in terms of the Planetree components is what's the effect on patient safety. We know for a fact that through education we empower patients to care for themselves, and what we see are fewer infection rates. We recognize in the hospital that once the patient leaves the hospital, their care isn't complete, and we know that there's somebody who's going to be taking care of them, whether it's at their home, hopefully at their home, or wherever else they'll be going. And so it's important to involve the family up front.
So Planetree listened to patients who said, I want information. So that's partly why Planetree has an open chart policy where patients are encouraged to read their medical record. And not only does it help patients feel empowered, but from a patient safety perspective, it's phenomenal.